Have you or anyone you know ever experienced muscle soreness or joint stiffness? Have you or anyone you know ever been diagnosed with a soft tissue condition such as plantar fasciitis, carpal tunnel syndrome, or fibromyalgia? Soft tissues include your skin, tendons, ligaments, muscles, and fascia, which is the thin covering around the muscles. Hello, my name is Dr. Randy Hamling, and I am here to introduce to you a treatment option that has shown amazing treatment results for all sorts of soft tissue conditions. Everyone leads a busy life these days where normal wear and tear accumulates within the body, and eventually everybody will suffer from a condition that involves their body's soft tissues if proper care and precautions are not enforced. Many soft tissue conditions, as a last resort, have traditionally been treated with surgery. Take carpal tunnel syndrome, for example. Carpal tunnel syndrome is characterized by pain and numbness in the hand and fingers. It is caused by compression of the main nerve supplying the hand due to increased tension. This tension is usually the result of an accumulation of microtrauma that is caused by repetitious movement patterns of the wrists and fingers, such as a job that involves much typing. It can also be the result of nutritional factors as well. The idea behind the surgical procedure for carpal tunnel syndrome is to cut that ligamentous band that holds your wrist together to take the pressure off the underlying nerves. By cutting this band, sure, it's going to take pressure off the nerve, but the problem is during the healing process where scar tissue is formed around the surgically damaged cut tissue. When this scar tissue accumulates, now there is even less room for those nerves to travel and more compression than there was in the first place. Now they may need to go back in to remove that scar tissue, and around we go. Here is a different scenario. Now let's say you have the same carpal tunnel-like symptoms, but the cause lies elsewhere. You go to that same medical doctor for the same symptoms of pain and numbness in the fingers. They diagnose you with carpal tunnel syndrome. They surgically cut that band, and following the surgery the symptoms are still there. The surgery is unsuccessful, and now you have that scar tissue buildup in your hand all for nothing, when really the problem lies further up the arm or even in the neck. Now this is the worst case scenario and doesn't typically happen because extensive testing is carried out before surgery is ever performed. However, most tests are not perfect, and this scenario is possible because I have seen this happen in the past. Therefore, before any surgery is performed, a second opinion by a chiropractor would be in your best interest because we look at the path the nerve takes from the neck all the way to the hand. Let me explain. A nerve entrapment anywhere in its course from the neck to the hand can cause carpal tunnel symptoms. Orthopedic surgeons are trained to cut and repair various tissues of the body and to prescribe drugs they feel will benefit your outcome. Those are their tools. Our tools are our hands. Along with our knowledge of neuromusculoskeletal systems, our hands are well trained to feel where the problem lies. We are able to treat conditions like these conservatively, without invasive techniques and without the risk of anesthesia or detrimental loss of function. Conservative treatment by a chiropractor may include the use of the Graston Technique, or GT for short. This is an instrument-assisted soft tissue mobilization technique, meaning through the use of these instruments we may be able to stretch and break up adhesions, such as scar tissue, in soft tissues that may be leading to your symptoms, bringing those tissues back to normal function without ever needing to resort to surgery. Today I'm going to educate you on the principle behind the Graston Technique. What are the instruments we use as clinicians, how the treatment is applied, and what conditions have traditionally responded well to this treatment technique. Graston Technique instrument-assisted soft tissue mobilization is defined as an advanced form of soft tissue mobilization that is used to detect and release scar tissue, adhesions, and fascial restrictions. It combines instrument-assisted soft tissue mobilization with a targeted exercise program to address soft tissue dysfunction. Soft tissue dysfunction includes scar tissue adhesions and restrictions which result in pain, weakness, and functional limitation for the patient. The technique uses patented stainless steel instruments that are designed to adapt to the various tissues, shapes, and curves of the body. GT is an advancement in the soft tissue mobilization that allows the clinician to detect and treat soft tissue dysfunctions in a precise and specific manner. The instruments are designed to provide as an adjunct to the clinician's hands, not replace them. The stainless steel instruments can be compared to a tuning fork. When contacting fibrotic tissue, the instruments reverberate, sending more precise information to the clinician. Much like a stethoscope amplifies what the human ear can hear, the instruments enhance what the clinician's hands can feel, therefore improving the ability to detect and treat soft tissue dysfunctions. Furthermore, it has been found that the resonating vibration also produces low-grade ultrasound qualities that also drive into the tissues, giving it its benefits in treatment.